Going up at LBJ Hospital for COVID overflow patients. Air 11 spotted the first of these going up this morning outside the hospital. It comes as this new wave of cases is putting a strain on local hospitals.
Hospitals are doing everything they can right now just to keep up. In fact, today alone, Texas is reporting more than 2,000 new cases. This number is up from 1,800 this time last month. Let's get out to Adam Bennett live at LBJ Hospital with more on the overflow and tent setup. Adam?
Mia, this is one of two county hospitals that serves trauma patients or people with limited means. The ICUs at both are either at or near capacity, and these tents, these will hold some of the overflow patients, but there's nobody inside right now because there's nobody to work them yet. This morning at LBJ Hospital, as doctors and nurses treated current patients inside, crews were busy setting up for possible future patients outside.
The last couple of days, they have had 20-hour waits.
Yesterday, Congresswoman Sheila Jackson Lee called on Governor Greg Abbott to get more nurses to this area. She says the governor must make that request to FEMA.
The only request that we have from the state of Texas are 5 mortuary trailers.
This afternoon, Harris Health told us LBJ's hospital ICU is at 100% capacity. 63% of those ICU patients are diagnosed with COVID-19. Ben Taub's ICU is at 95% capacity. 27% of those ICU patients are diagnosed with COVID.
Right now, the concern, the most immediate concern, is the nurses.
County Judge Lena Hidalgo says she's considering whether an emergency shelter like the one set up at Energy Park when the pandemic first started will be needed soon.
It's not something that is top of mind right now because the beds to some extent are there. The concern is the staffing.
Tomorrow, Harris County commissioners could vote to continue funding a COVID isolation facility.
It's been operational now for over a year and has helped isolate and quarantine over 500 individuals.
The city and county provide housing and services at a local hotel for COVID patients that don't need to be hospitalized but don't have a place to quarantine.
It will have start with 30 rooms to be able to quarantine and isolate clients in, with the ability to increase if needed.
The county has closed 2 clinics and also moved staff around to help with the staffing shortage. And they've also stopped elective surgeries at both Ben Taub and here at LBJ. Mia?
Adam Bennett with a look at the response. Thank you.